In this video I want to talk about the pharmacology of the stimulants, and we're mainly talking here about cocaine and amphetamines. Let's first discuss how someone presents with an intoxication. So you probably remember cocaine and amphetamines. These are indirect sympathomimetics. So in the end, you're going to get increased norepinephrine and increased dopamine. And if we know that, we can basically predict all the symptoms. I mean, our heart rate is going to go up. Our blood pressure is going to go up. We can develop psychosis. We're going to be very agitated, nervous. So that's how someone presents with intoxication with one of these medications. What is dangerous here? Well, it's definitively what people can die of are lethal arrhythmias, or even an MI, because cocaine constricts coronary, is very good in constricting coronary blood vessels, so it can give you a complete MI. So what about the treatment of intoxication? Well, because a person is going to be very aroused and agitated, usually benzos are given just to calm the patient down, benzodiazepines. And then we need to do something about the blood pressure. Well, and here comes an important point. You could give alpha blockers. You could give nitroprusside. But please, don't give a beta blocker alone. That could be really fatal. And I'm going to explain you quickly why. So now on the blood vessels, we have alpha-1 receptors, which are going to be leading to vasoconstriction. And we're going to have beta-2 receptors, less but still present. That's going to lead to vasodilation. Okay. Now, if we give somebody that has overdosed with cocaine or amphetamines, so they have tons of norepinephrine, it's going to go everywhere, right? So some are going to mediate vasodilation, but there's more vasoconstriction, so that's a major result, and therefore our blood pressure is going to go significantly up. Now, if we use alpha blockers, all good, because we would just block here these alpha receptors and prevent the vasoconstriction, so alpha blocker would be a good choice. But now imagine you would give a beta blocker alone. You're going to block these beta-2 receptors, and you're going to have unopposed alpha-1 mediated vasoconstriction. So your blood pressure is even going to go higher. So that would be really a bad decision. You could give alpha blocker plus a beta blocker. That's fine because you block everything. But please don't give a beta blocker alone. And that's also a heavily board-tested question. You cannot give just a beta blocker in an overdose with cocaine or amphetamines. Nitroprusside is another alternative that works via NO, just mediating vasodilation, so you're not going to touch the alpha or beta receptors. Now a few words about withdrawal, not as dangerous, not as worrisome as we talked about the CNS depressants and the opioids. So withdrawal here, you're going to see lethargy. It's always the opposite again. So this drug made you very aroused, very agitated. Now you have lethargy, depression, and also increased appetite, because they are usually suppressing appetite, so now you have increased appetite. But usually that's not treated, so that's something you're just going to observe and go through. This finishes this series on drugs of abuse and how to treat intoxication, withdrawal, and substance use disorders. Thanks for watching. Bye-bye.